All right, so good morning, afternoon, and evening, everyone. I know we have folks joining us from all over the world, and I want to be the first to welcome you to day 2 of the COVID-19 Pandemic Conference webinar, being sponsored by Routledge Publishers, the International Sociological Association, and Nazarbayev University. My name is Michael Ryan, and I will be your ringleader of sorts for the events over the next 2 days, as we hear from some of the world's leading experts on the COVID-19 pandemic and explore topics ranging from mental health to leisure to law and politics to social inequalities and really a little bit of everything in between. In my opening remarks today, I'm going to talk just briefly about pandemic numbers, consequences, and contradictions. Now, that's obviously a lot to cover in less than 15 minutes, but I do want to start the day by at least briefly touching on some of these issues and then look forward to our wonderful lineup of presenters to help unpack many of them. Now, most people in the world have not, at least so far, received a positive confirmation of infection with the SARS-CoV-2 virus. In fact, relatively few have, less than 2% of the global population. And yet those numbers are nowhere near consistent across the planet. In the USA, for example, the number is more than 10% of the population, while in many African countries, it's still less than 1%. In fact, the fact that the virus nor the impact of the pandemic has been evenly distributed is something that should really begin to pique our interest as social scientists. That said, the numbers are indeed shocking. As of today, there are more than 140 million confirmed cases of COVID-19 around the world, and more than 3 million confirmed deaths confirmed as a result of the virus. Before unpacking what those numbers mean, however, I want to draw special attention to the word confirmed, as there's little doubt, even among skeptics, that the actual numbers are much higher. Just how much higher is a matter of some scientific and especially political debate, but there remains a general consensus that they are in fact higher. Turning our attention to some of the consequences, the list is really inexhaustible, and exploring that list is what this conference is all about. The negative impacts of the virus have been more far-reaching than simply infection and death toll counts. As the COVID-19 pandemic continues to ravage the world, its people, and its economies, a number of long-standing inequalities are becoming even more pronounced. For a brief time, stock markets fell, and then they soared. Unemployment just soared. Billionaires lost spare change, and then they made fortunes. Essential workers just lost life and livelihood. The global elite flew off to private islands or sheltered in place in summer homes. The global poor just crowded into hovels, if they even had a hovel to crowd into. The current pandemic is indeed impacting different populations unequally, with the greatest tolls being felt among the already underprivileged. The number of indirect deaths from the pandemic is not one that's yet been calculated, but will no doubt far outstrip the number of direct deaths as tolls are taken into account from multiple other factors, including increased starvation, lack of access to medication due to disruptions in supply chains, suicides, victims of domestic violence, future deaths from viral complications, and victims of related hate crimes, among others. Further, as individuals who lost income had to spend money intended for medications on items like food, overall inequality levels have and are widening, which is a well-known predictor of premature deaths. And as pharmaceutical industries have halted research and production on treatments of other diseases, deaths from those will no doubt also continue to rise. If there's been any significant good aspect, it has likely been personally based, biased, and questionable when taken from the perspective of the social good. For example, while millions lost their jobs, investors in a number of companies, Facebook, Amazon, Nintendo, especially Zoom, and industries like the pharmaceutical industry saw their investments soar. Those supporting anti-immigration and anti-asylum policies have no doubt been pleased, and staunch supporters of particular political leaders have no doubt been happy to see them be able to enforce their policies at will without democratic checks and balances. Thus, certain ideologies, particularly those of a conservative nature, have found renewed fuel in campaigns of othering. One of the more has it been good or has it been bad cases is no doubt the impact on the physical environment. Despite the initial projections of potentially positive environmental impacts based largely on the sudden and dramatic drop in travel, for example, a number of other negative impacts have simultaneously come into play. As one example, there are growing concerns about increased water pollution, especially as millions of single-use masks are being discarded, too often simply as litter. Laurent Lombard, director of the French NGO Operation Mer Propre, has warned that, quote, soon we'll run the risk of having more masks than jellyfish in the Mediterranean. Thus, any positive environmental changes gained under the pandemic are likely to be temporary, as they do not reflect structural changes in the economic, transport, or energy systems. The pandemic has also presented a number of striking contradictions that perhaps best outline many of the underlying social structures that have created our increasingly unequal world. For example, while individuals were told to stay at home and almost daily informed by medical professionals of the dangers of traveling, hotels and tour operators began offering discounts, and restrictions on travel were haphazard at best. The broad global message was that travel was bad, but the enforcement of that message often came down to passports and economic means. In Spain, for example, intra-country travel restrictions were especially harsh, while the country simultaneously encouraged international travelers to visit to help their struggling tourism industry. It's reached such a level of absurdity that currently in Spain, it's easier for residents of Barcelona to travel to London or Berlin than it is to Madrid. The clear message was that travel led to contagion, but the mixed message was which travelers the state cared about being contagious. Another clear contradiction was in the message of economic impact. News headlines did not run short of messages touting a failing economy. Without any sense of irony, they also often ran headlines alongside those of growing poverty levels, increasing food insecurity, and rising death tolls, with those of celebrities partying on private islands, record-setting stock markets, and the near daily switch between Jeff Bezos and Elon Musk competing to be the richest man, emphasis on man, in the world. Economies were failing for most, but booming for a few. Thus, while extreme poverty increased for the first time in more than a decade, the world witnessed its richest men reaching historical levels of individual wealth accumulation. And in no headline, at least that I have seen, was there any exploration of the underlying social system that made those two facts simultaneously possible, much less interdependent. Another contradiction emerged with the portrayal of essential workers, a relatively never used catchphrase that became widely popular in 2020. In short, essential workers are those who are necessary to keep the economy, and more importantly, our lives, running. Jobs like refuse removal, agriculture, product delivery, and personnel at food outlets all fell into this category. Worth noting is that none of those professions considered essential workers were among those who benefited economically during the pandemic. In reality, and with all due respect to those who put their lives on the line to keep our societies running, many of these heroes are perhaps better thought of as people without options. Most of those classed in the category of essential worker are from the lower classes. They live paycheck to paycheck and don't share the comforts of healthy savings accounts, stock market investments, and white-collar professions, all of which were more likely to be able to transfer to a digital format, than many of those from the upper class who were suddenly heaping praise upon all these essential workers. They continued working because they had to in order to survive, not necessarily because they wanted to put their lives at risk to scan our groceries. In short, many, though certainly not all, essential workers came to represent a type of heroism that is perhaps more accurately thought of as involuntary human sacrifice made to look voluntary. Finally, and most recently, another contradiction that's emerged during the pandemic has been the near universal high hopes heaped upon mass vaccinations. This hope in and of itself is not entirely off the mark. Indeed, most experts agree that full vaccination is the only long-term feasible way out of a pandemic. Masks, physical distancing, frequent hand washing, and other measures remain the best short-term solutions. That said, while touting vaccines as a halo solution, the supply and distribution of global vaccines for other known killers fell off dramatically. In the United States, for example, where vaccines are widely available, it's estimated that children alone missed more than 9 million routine vaccinations in 2020, including for the measles, polio, and whooping cough. In short, vaccines have been praised as a solution, all while vaccines are being skipped, thus creating more problems. In our sessions today, we'll look deeper into many of the issues I've just raised. Our first session, for example, includes presentations examining the interrelationship between poverty, education, and the economy in a rural, predominantly minority town. The second part of that session will look at the particular unequal impact of the pandemic on the lives of gender and sexual minority peoples, and then an insightful presentation on the too often overlooked issue of homelessness. Our second session of the day will take a closer look at the psychological impact of the pandemic, including presentations on managing trauma and developing resilience, treating loneliness, and a comparative analysis of the visibility of female nurses' voices in the USA, India, and China. For our third session today, we'll turn our attention to the impact of the pandemic on leisure and the arts, including presentations on the impact on the sporting world, the implications for artists in Malta with lessons for artists worldwide, and a fascinating exploration of social media content from the Arab world. We'll wrap up our day today with a much anticipated keynote address from Professor I. Glenn Cohen, Deputy Dean of Harvard Law School and Director of Harvard's Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics. In his talk, Professor Cohen will examine the intersection between the pandemic and the law, with a focus on issues of surveillance and inequality. By way of preview, tomorrow I will open the day with remarks on what pandemic inequalities mean and the possibilities and potentials of a post-pandemic world. We will then have sessions on changing social understandings in response to crisis, social injustices, and changing understandings of the social order. For tomorrow's keynote address, we'll be joined by the current president of the International Sociological Association, Professor Sari Hanafi. So without further ado, let me end by once again thanking all of you for tuning in with us today. I obviously knew that time zones existed, but I've never been made quite so acutely aware of them as when trying to plan a global conference. So I know it's early morning for many of you, lunchtime for others, and well into the evening hours for our friends further east. So thank you all for taking the time out of your busy mornings, afternoons, and evenings and joining us. I truly believe that the scholarship lined up for the next couple of days is something unparalleled, at least from what I have seen, and I very much hope that you will agree. So with those brief opening statements, I now want to wait just a couple of minutes in order for more folks to be able to join us, and then we'll kick it off with our first session on exacerbating inequalities. So we'll be back in just a moment. Thank you.